become more brittle and fragile, typically as a result of hormonal changes or deficiency of minerals such as calcium or vitamin D. Bones are in constant state of remodeling. In other words, old bone is broken down and replaced with new bone. Osteoporosis occurs due to the loss of both a mineral and protein matrix, making bones extremely fragile. Bones are made from very strong elastic fiber, collagen fibers, and more robust materials such as minerals. This disease is known as a silent disease, as it does not occur instantaneously but over a prolonged period of time, as well as not showing any symptoms. So you may not know you have osteoporosis until a strain, bump, or fall causes a bone to break. The first sign may be a fracture due to weakened bones. About 200 million people in the world are estimated to have osteoporosis. About 1 in 3 women have osteoporosis and about 1 in 5 males have osteoporosis. Osteoporosis is the most common bone disease. The risk of attaining the disease is higher in women than men, although all races, sexes and ages are susceptible to the disease. As you can see here, roughly around the age of 40 to 50 is when the loss of bone mass occurs, and it increases as you grow older. Women are more likely to develop osteoporosis because they typically have less bone mass to start with than men do. Women undergoing menopause are also experiencing a sudden loss of estrogen, a sex hormone that helps build and maintain healthy bones. The importance of healthy bones are provide support and the ability for us to move, as well as providing protection of vital organs such as the brain, heart, lungs. Though osteoporosis can be prevented by certain exercises or more preferable diets and lifestyles and other factors.
In Europe, 22 million women and 5.5 million men have osteoporosis. In the United States, about 53.6 million people are affected. By the year 2020, there will be 20% estimated increase in osteoporosis caused. Both genders are affected, and the risk is high once they reach the age of 15, women in particular. The prevalence of osteoporosis is highest among white women, 50% lower among black women, 25% lower in Hispanic and Asian women. Hip fracture is most common in women, but mortality rates due to hip fracture is higher in men. Osteoporosis risk factors. It is divided into two, non-modifiable and modifiable. For the non-modifiable, we have age, premature menopause for women, primary secondary amenorrhea for women, primary secondary hypogonadism in men, ethnic origin, white or Asian, high bone turnover rates, family history, and neuromuscular disorder. For modifiable, we have excessive alcohol consumption, low body weight, long-term immobilization, cigarette smoke, of course, those fall down into that, poor visual acuity, and low dietary calcium intake.
Osteoporosis is a chronic multifactorial disease that progresses slowly and may take years for symptoms to show. The development of the disease is thought to be triggered by the disruption of the bone cycle, and that can be caused by different factors or conditions. And we have primary osteoporosis, which is also known as postmenopausal osteoporosis. It's estrogen related and affects more middle-aged women or women entering precocious menopausal states. It is the most common type diagnosis and affects more women than men. Estrogen is important in bone remodeling cycle. So when women enter postmenopausal states, estrogen levels drop in the human body, and that disrupts the cycle. Next, we have secondary osteoporosis, which is caused by factors other than hormones or age, such as endocrine imbalances, such as thyroid disease, autoimmunity, such as rheumatoid arthritis, electrolyte imbalances, such as altered calcium and vitamin levels due to poor diet or other underlying conditions. And we have medication, such as thyroxine, used in hormone replacement therapy. Thirdly, we have age-related osteoporosis. Naturally, in the human body, after the age of 30, the bone formation and bone resorption rates change and invert. with associated genetic predisposition and higher risk factors, it may lead to early and faster cellular aging and thus aggravating bone loss. Outcomes and consequences vary depending on the bones that are fractured more easily. The bones with higher wear and tear and higher leverage fracture easily, such as wrists, knees, the femur and hip bone. Consequently, this will cause decreased mobility, chronic pain, greater risk of fractures when exposed even to minimal stress, extended periods of immobilization and loss of independence. This will lead also to invasion procedures to try and alleviate the conditions, such as hip fracture replacement, decreased quality of life, increased living expenses to the patient and to the NHS, and psychological damage caused by the loss of independence, as people will feel like a burden.
The function of bones is to help us with movement and posture. It consists of two types, compact bone and spongy bone. Compact bone is on the outside and it's like web material, and it helps us with pressure and weight of the body. Spongy bone is in the inside and it's soft, and it helps produce blood cells. Calcium helps us with muscle constriction, including heartbeat, and stronger teeth and bones. Phosphorus helps us with the formation of proteins for the growth and repair and maintenance of cells, tissues and bones. Also, vitamin D helps us get calcium from the diet. As you can see, there's a picture of a healthy bone and a picture of a bone with osteoporosis. They have structural differences. An individual with osteoporosis means that their bones have thinned to the point where the physical structure and the sound have changed. The bones will be weak and brittle. Most common bones that fracture or break are the hips, vertebra and the wrist. The vertebra is the part of the spinal cord located on the upper back of the spine, and that's why it results to a hump at the back of the person with the osteoporosis.
Osteoporosis is often diagnosed after a weakened bone that have led to a fracture. Normal X-ray cannot be used as it doesn't measures the density of a bone. Dual energy X-ray is also known as DXA scan. Is used to detect the small percentage of a bone loss. It is a quick, painless procedure that takes only 5 minutes to do.
How the bone density is measured. During the DXA scan, X-ray is passed through the body. Some of these radiation are absorbed by the soft tissues and the body. The DXA scanner measures how much of this radiation has been passed through the bones, and then the information is sent to the computer. The results are then compared to average measurement. There are different types of scans. For example, DXA scan measures the heels and breast. DPA measures the spine and hips. SPA measures the breast. QCT scan measures the spine and hips. During the DXA scanner, very low radiation is used than a normal X-ray.
In order to diagnose and treat osteoporosis in a particular patient, it's really important to check the mineral density level of that patient. And in order to check the mineral density level, there are different scans like DEXA or DXA scan. Sometimes X-rays are used to check the condition of the bone, like if they are thin or in normal healthy condition. On the basis of results and different factors like age, gender, previous history of injuries, risk of fractures, etc., the decision is made what treatment is beneficial for that particular patient. Bisphosphonates are widely used medicines to treat osteoporosis. These medicines affect on your parathyroid gland, parathyroid gland produce parathyroid hormones and teriparatide. They help increasing the calcium levels in the bone, and they also help in activation of bone producing cells. So they are really, really important to treat osteoporosis. Raloxifene are artificial hormones which act or work by copying the effect of estrogen in the bone. Prolia is a biological treatment that work by blocking the formation of the cells which are responsible in the breakdown of bone.